Simplified explanation. Isolated atrial amyloidosis is a condition where a specific type of amyloid made from atrial natriuretic peptide, ANP, builds up in the atria of the heart. It is common in older adults and happens as part of normal aging. The amyloid deposits are limited to the atria, the upper chambers of the heart. Over time, these deposits can disrupt the normal electrical activity of the heart and increase the risk of atrial fibrillation and irregular heartbeat. USMLE Question 1. A 78-year-old man is found to have atrial fibrillation during a routine checkup. Echocardiography shows thickened atrial walls, and biopsy reveals localized amyloid deposits made of atrial natriuretic peptide. Which condition is most consistent with these findings? A. AL amyloidosis. B. AA amyloidosis C. Isolated atrial amyloidosis. D. Hereditary transthyretin amyloidosis. E. Senile systemic amyloidosis. Correct answer C. Isolated atrial amyloidosis explanation. Isolated atrial amyloidosis involves amyloid deposits from ANP and is common in the elderly. It increases the risk of atrial fibrillation. Why not the others? AAL involves light chains and usually affects multiple organs. B. AA is related to chronic inflammation. D. Hereditary TTR affects nerves and the heart more diffusely. E. Senile amyloidosis involves transthyretin in the ventricles, not just the atria. USMLE Question 2. Which peptide is responsible for amyloid deposition in isolated atrial amyloidosis? A. Beta-2 microglobulin. B. Serum amyloid A. C. Immunoglobulin light chain. D. Atrial natriuretic peptide. E. Answer D. Atrial natriuretic peptide. Explanation. In isolated atrial amyloidosis, ANP forms amyloid deposits that affect only the atria and are associated with aging and atrial fibrillation. Why not the others? A. Beta-2 microglobulin is seen in dialysis-related amyloidosis. B. Serum amyloid A is part of secondary AA amyloidosis. C. Light chains are seen in AL amyloidosis. E. Transthyretin is involved in cardiac and hereditary systemic amyloidosis.